everybody, welcome to the Osteophysio YouTube channel. So for today we are filming in a slightly different location. So today we are actually at Luna and Wolf Yoga Studio, which is why it looks a little bit different. So for today we are going to be addressing the main conditions that are causing pain to refer around the front of the neck. So some of the main conditions that can refer around the front of the neck. So if we're thinking first of all mechanical causes, number one, tightness into the accessory muscles around the neck area. Most commonly the SCM and the scalenes, all the muscles around the front here, attaching from the neck and blending down towards the first and second rib with the scalenes and around the top to the collarbone with the SCM. So if we're thinking that we're quite stressed or we're working at a desk, or particularly if we've got quite aggravated breathing, so the accessory muscles are breathing, everything gets really tight, and so what people feel like is almost like a hand around the front of the throat. Everything feels really, really solid, and that's where you can get that real kind of dull ache into the neck. Number two, we can get actually cervicogenic referral. So it doesn't typically give over the whole of the neck, but if we've got aggravation of the facet joints around the front, around the back of the neck, we can get a little bit of a dull ache round into the front. Number three, we can get issues with the TMJ, so aggravation and issues with the temporal mandibular joints up through here. So if we've got any aggravation with the disc or fatigue around the masseter muscle around the TMJ, obviously it can give localized pain here, but can also refer down into the neck. Another structure that can be involved in referring pain around the front of the neck can be around the first rib, so deep behind the collarbone. So this can either be due to a repetitive posture or a repetitive activity, for example, coughing, sneezing, talking, anything like that can inflame if we do it too much. So if you've had a cough and a cold this time of year, this can inflame the first rib, or trauma through the area, so any impaction injury down into the rib. Obviously if it's tender, we can get pain around the back where it attaches into the thoracic spine, as well as round into the front, and then a cascade effect of that is tightness of the accessory muscles, for example your scalenes, that attach into the first rib. So with all of these, the aims of the osteopathic treatment is to soften and release any tightness around this area, looking at the whole of the mechanics, so how your neck is moving, how your shoulders are moving, opening up through the ribs, because you think if your neck's dropping forward, even if the pain's here, it's going to be impacting how you're moving your upper back, your ribs and your shoulders. So it's all about opening up through the body and then strengthening the posterior chain, so the rhomboids and the muscles around the back, to lift up through. Some key things we have to consider though are possible red flags that could be giving you pain round into the front. So any issues with the thyroid, any issues with the esophagus or the trachea, anything like that. So what you would normally find is if you are getting abnormal symptoms in association with this, so difficulty speaking, swallowing, you would find any kind of abnormality of symptoms in terms of like coughing up blood, anything like that. So it's stuff that doesn't seem to follow a mechanical pattern, i.e. hard to reproduce the pain, you can't aggravate it or relieve it on certain vectors of movement, so it sounds a lot more kind of underlying. And obviously with that, it's so key, go and see the experts, for example your GP, get it checked out. If that's all clear, then of course, you know, there potentially could be a mechanical association, that obviously that is what we would look